My name is Sharon Kaiser, and I'm a physician, and what my role is, I take care of kids with headaches. So when I say kids, it means small babies, big babies, adolescent, all the way young adults. So I take care of their headaches. Throughout my career, whenever I see patients, and especially the first encounter, almost every time they tell me they have been treated, they have been given medicines, they have been taken care of in one way or other, but they have not been listened to. So the philosophy is, well, I walk into a room and I want my patients to teach me and talk to me and tell me. That's our philosophy. So it's a bi-directional thing. That then leads to the second part of it. Well, we just don't want to treat patients, we want to educate them. Why is that? Headaches are very common. It's very common. They're plagued with familiarity. They're very common. So I can't go out and see all the headaches. But what I can do, I can teach my patients about simple things. Oh, how to be healthy, hydration goal, what are the good sleep-wake patterns. And what happened almost every time when they come back for a follow-up, they tell me that they have been teaching their friends, their family members, their cousins, their siblings, and it's part of that continuous education. So that comprises the philosophy behind this clinic. Common things don't mean that they don't need uncommon measures. For example, just to give you numbers, headache is the leading cause of morbidity in the world. 20% of middle school or high school children in America alone, they miss the schools for different medical reasons. Out of those 20%, 50% miss schools because of headaches. So we are talking about millions and millions of kids not being able to go to school. Why? Because they have, quote unquote, a common problem, which is headache. So the more I knew about it, so the more I realized there is an unmet need. Unmet need to fix, well, first, it's under-recognized, and it's under-treated, and even under-diagnosed. So that made me interested, well, I need to do something about it. And that's how I started my journey into headache. I trained myself into that I got into a fellowship program in the world leading headache program, specifically for children and adolescents. And that was the basis. That's how we talked about setting up a new program at University of Kentucky. And that's how it came into being. Common things at times need extraordinary measures. So ordinary things, extraordinary measures. How can you achieve that? Well, you need a multidisciplinary team. You need clinical psychologists, you need dietitian, you need different strategies, you need nurses to support. So all these things, then you need some kind of a tertiary or quaternary center who can provide all those resources. And here at UK, we have all those resources. So it's just not me taking care of a person with a pain syndrome or a headache. No, there's so many other aspects. So there's so many moving parts. That's why we need an institute that provide all these things. And here at UK, that helped us to build this multidisciplinary clinic. We keep kids happy and we keep them in school. We enable them to do things they enjoy. So that's the coolest part of my job.